With a little one in the family, it is important that we constantly look for ways in which we can keep them healthy. While there are many reasons because of which it can turn out to be difficult to take care of your toddler, it is also important to realize that there are possible solutions for every issue. We should be ideal for you while you're working hard to ensure that your toddler is healthy and stay healthy forever. Top 10 Health Tips for Toddlers Parents Should Know. 1. Daily care. All daycare is important for your baby, and it might feel like your responsibilities never end. However, the fact is that it is not difficult if you have organized yourself in a way that everything happens in the correct order. Starting with bathing a toddler, make sure that you teach them how to brush the teeth, change the cloth nappies, ensure hygiene and keep them clean at all times. As a toddler, you can expect them to make the place and even their clothes dirty at regular intervals. In this case, it is essential for you to be patient with your babies and take good care of them. 2. Avoid disposable nappies. Not only it is an additional cost but also has the potential of leaving behind a negative impact on your little one. Disposable nappies are not highly regarded for toddlers, and you should avoid it, even though it is an easy option for you. Remember that your baby is your priority and nothing else should get the same spot. 3. Check for major health concerns. From the birth itself, we start taking care of the baby, and we even consult a birth injury attorney in case things go wrong. However, as days pass by, there will be some issues you'll learn about, and accordingly, you'll have to find the necessary solutions. For example, you might not know at birth that your baby is allergic to something. However, the moment you learn about it, make sure that you do everything possible to keep your little angel away from it. Apart from regular allergies, intolerance management should even be on your mind. Apart from this, make sure that your baby is not a victim of second-hand smoke. 4. Mental health. Anxiety in children can be a cause of concern for any present in this world. However, there are ways in which the same can be taken care of. So, make sure that you manage your child's mental health and do not add to the issue in any possible way. 5. Doctors and medicines. Regular checkup of your toddler is important, and it is equally important to give your toddler the medicines prescribed by the doctor. Your child might cry while you're feeding them with medicines, but be strong and make sure the task is completed. 6. Learn toddler care first aid and CPR. It is one of other vital health tips for toddlers that parents should know. It won't hurt to learn what to do when a toddler gets scrapes, bruises, and bumps, and everybody, especially parents, should be CPR certified. This is known as an emergency process that is performed on anyone whose heart has stopped or who isn't breathing. When this occurs, seconds count as the brain damage or it can lead to a death. For toddlers, the major emergencies turn around their airways, which are caused due to choking or near drowning. Therefore, it is essential for parents to learn how to re-establish the air for their toddlers. 7. Promote healthy eating. Now, childhood obesity can be considered a tremendous epidemic. Therefore, healthy eating is one of the health tips for toddlers. This means that parents should give appropriate serving portions for their child. They will eat when they are hungry, and when they aren't, they won't. So, don't worry about it. According to the USDA, 2-year-old children consume 1,000 calories a day, 3-year-old children, it is from 1,000 to 1,400 calories daily, which depends on their activity level, and 4-year-old children, it is 1,200 to 1,600 calories a day. Keep in mind that the daily dose of calories of your toddlers includes the following nutritious foods: fruits and vegetables, whole grains, and calcium-rich foods to grow bones. Remember to limit juicy juices and sugary foods. 8. Establish a good oral health habit. The National Center for Health Statistics published a report and found that the tooth decay in children at the age of 2 to 5 is increasing. 28% of the children in this age range develop at least one mouth cavity. Not only do dental exams every 6 months help to prevent cavities, but it also aids in preventing the tooth decay that may result in malocclusion, which is an improper position of the teeth and jaw when a child is older. Make sure that brush your child's teeth when the first tooth appears. As you may know, by age 1, you can use a soft toothbrush or soft washcloth dipped in warm water to brush the toddler's teeth 2 times per day. At age 2, give your toddlers a fluoridated toothpaste, and by age 4, toddlers may handle their brush themselves. You can choose the foods that can help to prevent cavities. For example, avoid sugar-laden snacks and serve organic fruit juices to your child. So, teach your toddlers to take care of their teeth to help to prevent tooth decay and bacteria and abscesses in the gums, causing illness. 9. Give positive feedback. Praising a good behavior of your children not only helps to encourage them to learn about their environment but also aids in promoting the parent-child bonding. You should guide them through the experiences in a completely positive way. Often, a toddler who is encouraged will feel good about himself and his accomplishments. It makes a significant difference in self-esteem. In contrast, when you criticize your toddlers too often, they can become withdrawn or unsure of themselves, and can be afraid of trying new things. So, try to offer hugs and compliments more often. 10. Don't smoke around your toddlers. For smoking, you are aware of the health impacts on yourself, but do you realize that secondhand smoke may also affect the breathing of your toddler and have long-term respiratory impacts such as impaired lungs, wheeze, and chronic coughing? Often, toddlers of smokers visit a doctor more often for treating wheezing episodes and respiratory infections than non-smokers' children. Secondhand smoke can cause more ear infections, more allergies, more asthma, and more upper respiratory infections. Also, it sets a bad precedent because toddlers model the behavior of their parents.